We had a wonderful group that had a lot of comments. So we're going to start with what did they like. So they liked that capital development funds were being used to build units. They liked the emphasis on TAY, that we are building TAY units, although they did say that we needed more. They liked that I was here. I just want to point that out. That's what someone liked. They liked that we're helping board and cares. And someone said they felt like we were really covering all the bases as it related to housing. And they liked that we had 83 new developments being in process or open. So we focused more on suggestions, which I think is how it should be. So one suggestion was that we go to the neighborhood council meetings and talk about the work that we're doing. Another was that we have classes in communities or in housing for older adults, that we could bring mental health services in there to do classes and education to provide supports to older adults in their housing. Let's see. They liked that, the suggestion was to make people aware of available housing and that people can go somewhere and see where do we have interim housing and permanent housing. I did say that the CEO put out a GIS mapping that shows interim housing and permanent supportive housing, so we got to make sure people know about that. They suggested that we have a system for housing providers to list their resources. That we allow shared housing to be listed and on the different housing listings, that some places, someone said that they didn't see shared housing, that we focus on homeless prevention, that we work on issues of affordability and rent control, legal protections and tenant rights, look at individual differences in the length of time that they were homeless when we're helping people. So looking at, suggestion was that people that were homeless longer, that we help them first. Suggestion that we help with housing navigations, particularly with TAY was brought up, helping TAY and helping people find housing so their certificates and vouchers do not expire. Let's see, that we have more drop-in centers. Someone called them refresh spots where people can go, they can shower, they can eat. And they can have mentors and get help. We have accountability for homeless service workers, including training on trauma, that we make sure that our workers can work most efficiently and with people. Suggestion that we have long-term residential treatment that has quite high quality, that we have more psychiatric hospitals, data integration and coordination between different systems. That we provide information about the housing program expansions for agencies. So agencies that might have DMH money, how can they get money to provide homeless services? That we help people feel part of the community and help the community accept the people that are in their community. And that we make sure that people are treated with dignity, that we streamline the process for contracting, and that there is quality oversight.
Right on.
I think that covered it.
That was exactly 3 minutes.
All right. Oh, did I forget something? Grievance procedures. We make sure that people know what their grievance procedures are. See, the committee's still giving their suggestions. Yes, that was one.
Money for families.
And money, oh yeah, she had a very interesting idea that families get money to provide the supports to their loved ones rather than having the system always have to get funding to provide supportive services. Thank you. I'll end there.
Yeah. Thank you, Rita.
All right, so we did wet, innovation, and capital facilities. So most of these are suggestions and recommendations. Family member training to support family members. And you talked maybe a little bit about NAMI. Inclusion of families with peers. And this is the idea of Innovation 5, not just focusing on peers, but also focusing on family members. A concern was basically to ensure that trauma trainers do not perpetuate trauma, so we're looking at that. And a recommendation in the same one around implicit bias training for all trainers. Ensure that the program is ready to implement before it is being promoted. That would be a good thing. And in terms of workforce education and training recipients for these dollars that we're talking about, eliminate any selection bias in terms of projects for the recipients. Need funding for accommodations for those with physical disabilities. There was a couple of discussions around the underserved cultural community group for physical disabilities, and particularly as it relates to the ability to develop a project, and then the department takes it over to be able to create training. And so basically having the USCC work collaboratively with the department around that. There was a really good suggestion to disseminate all of this at the PRC, our Peer Resource Center. Let's see, talked about that. Workforce strategies to infuse services in Skid Row, but with inclusive of people that live in the area, and not, you know, because to avoid people coming into the area getting scared and then leaving. TAY or youth councils, they recommended, and how we might implement that. Let's see, link the USCCs with WET to create employment opportunities for people that are in the USCCs. Peer specialists working with law enforcement was an idea. And then using technology to train the workforce. So this would be around the technology suite and how we would infuse technology to train people. And then there was a request to define what a peer is. And so we said Karis Myrick would do that very well. Thank you.
That was in 2.5 minutes. Wow.
We have
Good. We have public comment. Thank you. Yeah, again, you'll have public comment opportunity at the end. So let's go, Darlish.
Hi, so we had a very lively group, and so we'll start with what they liked. They liked that there was more detail given in this particular stakeholder meeting than what was previously given in the last meeting. And I think as we discussed that, you know, as we move along and we get more information and we get more input, we're able to provide more details and have more in-depth conversations, so they liked that. And that we clarified there was some confusion about the website, that the summary that was posted on the website and not the plan, and we clarified also that the plan would be posted around March, mid-March, and so the detail would be there, but we cleared up the confusion, so they liked that. There was a comment about therapeutic preschools and having more intensive services for our 0 to 5 population, our children that are going to preschools and are not able to stay in preschools because of behavioral problems and being exposed to trauma. And we did speak about DMH's current effort to fund early education centers through our school-based platforms and training teachers in a model known as SEEDS that really specifically targets that 0 to 5 population. So that was liked. And they appreciated that there were some additional PEI programs that were coming on these community-based platforms. And that outreach was a key component of prevention, and that we're doing it at the community level. There was like that we are still doing the promotores. We still have promotores, and that we are extending the promotores model into other ethnic groups and other languages through our promoters, and specifically wanted to see more of that for the African American or African communities, and that we want to have more monolingual Spanish promotor trainings. And so also the last like was that PEI has been helpful to improve access to mental health treatment, that because of expanding PEI, that folks are now becoming more aware of their options and services that they're able to receive. So I'll move to suggestions. Some of the suggestions that we received is that we do need to continue to increase the detail on our EBPs on our website. There was some confusion about maybe that some of the EBPs are going away, that we haven't been highlighting the existing EBPs, and so we clarified that we are still doing all of the EBPs that we have done in the past, so we need to clarify more of the details around that at our site. And that we extend or expand services for our migrant population, our Spanish population, given that they are a large part of the LA County population, that there is more services for them and that they're able to provide more input into services.
2 more minutes.
Oh, 2?
2 more minutes. Yeah.
Okay. Okay.
Sorry, I'm trying to move it along.
Sure. And that One of the suggestions that we had a lot of conversation about was the integration of alternative practices into our traditional mental health system, meaning using doulas and using non-traditional medicines, and how does that play into supporting folks with their well-being, and if prevention can be used to support some non-traditional practices for well-being. Again, promotoras, extending it to other communities was a suggestion. And also there was a large focus on incubation academy and capacity building projects that could be implemented countywide. One of the suggestions was there are projects that have been done by our USCCs that have been done for those specific communities, but if those projects were successful, why couldn't those projects be replicated and expanded to other populations? And then lastly was that there should be increased information about how to apply to the Incubation Academy and how agencies can receive support in doing that.
Thank you, Douglas. Thank you.
Okay, we discussed that the intensive care division is merging, and that merge is including the treatment authorization unit and what was previously known as countywide resource management. In that merge, what we're doing is, and we discussed that it is including two teams, a team of clinical reviewers and a team of navigators. And one of the ideas that we have, we're going to pilot, or we're going to do a project that will have clinical navigators, and we're going to assign the navigators a point of contact that will follow patients through the system from inpatient to enhanced residential services as they go through the level of care. And that was one of the things that this team liked. Other things that they liked were that we're going to increase the beds in the system. Urgent cares they thought were a really good idea, the crisis residential beds, and the additional beds in the system as a whole. We tended to focus on suggestions. So the suggestions that they voiced were concerns about getting persons into services as a whole. There's a glut in the system, and we discussed that even if we address increased beds in the system, it's sort of like moving the bubble. We discussed improving coordination between Department of Health Services, DMH, and the sheriffs. And we discussed improving the network of care in each area. Other things that were concerns were there were concerns about the IMD plan and moving individuals from hospital beds across from other hospital beds. And there was an appeal with redesigning MHSA as a whole. Other suggestions? They suggested that the navigator be a person that was an active navigator, and that the navigators as a whole be persons that could be on call and persons that could be responsive. They suggested a partnership with quality of life teams and with home teams, and partnerships with quality liaisons, with court liaisons. So those were the suggestions that we received. They were excellent suggestions, and we'll pass it on to Lisa.
That was exactly 3 minutes, thank you. So, Lisa, last one.
Okay.
I won't start until you get there. Don't fall, don't get to yourself.
Okay, we covered FSP and our outpatient programs, and although I'm not sure why "what did you like" is empty, it wasn't. There were a lot of comments about what folks liked about what was shared. Some of that was just the fact that we were transforming FSP. Folks liked that we were going to be more specific about what the requirements were. There was positive comments about the staffing patterns that are going to be required now, and that there will be lower caseloads and certain kinds of staff who will be mandated. They liked that we're going to have support for the transition, and also that the transition would be phased in. Now, some of the suggestions: how do families receive support? Like, how do we involve families more? And we shared that there was training planned with UCLA to be able to incorporate families into treatment. Somebody had suggested a discipline chief for families. They said, we have a discipline chief for peers. Can we get one for families? A need for more parent advocates, comprehensive explanation of FSP and staffing patterns. And I had shared that there are documents that we can give out now, but our final service exhibit has to go through county council and CO before we can share what the final is. And know what the payment sources are. We discussed some of that, how we want to take away any barriers that payment sources would cause, that there could be more flexibility across age groups, across payment services. And related to payment was the issue of folks who are undocumented, who have to end up staying in FSP because there's no funding to keep them housed otherwise, even though they're not at that level of mental health acuity. We talked about the partnerships with the housing division to find more ways to subsidize housing. Clear definition of high acuity. We clarified that when we say high acuity, what we mean is our SPMI population, severe and persistent mental illness. FQHCs, somebody had requested that we can help partnerships between FQHCs and behavioral health. Some of them have worked out, many of them have not. We maybe need to have some kind of MOU or some sort of understanding of shared parameters and expectations. And then changing the structure of integrated health, that was also related to the FQHC issue. So that's it.
Thank you. Thank you, Dick. I appreciate it. All right, so we are now in, first of all, let's give them a round of applause for not only facilitating, I think, in a very wonderful way, but also summarizing, I think, the key points in such an efficient way, so thank you. So we are now in the last part of today, which is public comments. Let me just say a little bit about that. We are now, it's 11:36.